Hi, welcome back. This is Dr. Ramu Harirajan, ENT consultant, KKR ENT Hospital. Today we are going to discuss particularly the frontal sinus, and this is a revision case with the sinonasal polyposis with the involvement of right frontal sinus, and here you could appreciate the right frontal sinus cell, the interseptal frontal cell, and the left frontal sinus. And as you see, both the right frontal sinus and the interseptal frontal cell are diseased. So I like to highlight the frontal approach, and this is the nasal cavity which you see on the right side. It is a recurrent polyposis. It was operated previously and just infiltrating the 2% xylocaine with 10 drops of adrenaline along with 10 ml of distilled water. Nasal cavities are packed again to obtain further hemostasis and decongestion. So once the pack is removed, the polyps are debrided, which are filling the antrum and also the anterior ethmoidal region, shaving it off. Just delineating the margins of the maxillary sinus. Progressively removing the polyps in the posterior ethmoid region also. Due to the disease process or due to the surgery that was underwent, you won't appreciate a proper landmark in a revision case. Actually, you need to define the landmarks. The standard landmarks, medially you should try to appreciate the middle turbinate if it is present, and laterally the lamina papracia. And here the middle turbinate was preserved, and this is your superior turbinate, and I'm working medial to it where I will reach the sphenoid sinus. So now I'm going medial to the middle turbinate and debriding the polyps that are hidden behind and also hanging in the choana. Just working on the margin of the sphenoid ostium and widening it out. Very polypoidal changes, a lot of polypoidal changes, mucosal edema, all things are seen together. See the amount of edema and polypoidal tissues even within the sphenoid, and thus you are able to appreciate or see the opposite side sphenoid also, because it was already eroded by the disease per se. Now trying to gently sacrifice or widen the sphenoid ostium and removing partially the superior turbinate. Gentle scraping over the mucosa of the posterior ethmoid. The sphenoid looks widened, and I think we are done with the maxillary, the sphenoid opening. The frontal sinus is now approached. It changed to a 70-degree endoscope. With a gentle suction, I was trying to clear the frontal recess area. I could see some thick fungal debris with the fungal mucin coming out of the recess, frontal recess region. The entire region looks very edematous, thickened mucosa. With the help of the microdebrider and 60 rad, I was debriding the edematous mucosa around the frontal recess. As we saw in the scan, we appreciated a frontal cell and interseptal frontal cell. So that is what we are going to define now. So I could see a cell that is medial, that is close to the middle turbinate, and one cell little away from the adjacent cell. See here, you can appreciate two depressions. One that is medial is your interseptal frontal cell, and that's which is adjacent laterally is a true frontal. With the J curate, I was trying to remove the fungal debris which was hidden inside, and I was not able to achieve completely, and I was trying with my curved suction also. I still couldn't reach to that height, and finally decided to give a saline wash. So this usually helps. It's a wonderful way of taking the fungus from the frontal recess without much damaging to the surrounding mucosa around the recess. See that? We're gently able to take the fungal elements outside. Still, there are a lot of fungus inside. So once again, I will give a thorough washing again. So the advantage of washing, or the advantage of general anesthesia, is that we can do as much of washing as we can, which is not possible when we do it under local anesthesia. The chunk of fungal element was just flushed out from the frontal sinus or interseptal frontal cell. And you can see the amount of, and it was just cleared. So unhealthy mucosa was taken off, and a last bit of fungus was removed. Now I was convinced that I cleared the interseptal frontal cell. So after a couple of washing, I was able to appreciate both the cell, interseptal frontal cell on the medial aspect and the true frontal cell just adjacent to it laterally. So complete clearance of the disease from the frontal sinus. And the MMA was clean. This is the end of the procedure. I have a clean nasal cavity, all the polyps have been removed. See a really a large MMA, middle meatal antrocenia widened sphenoid, the skull base and the frontal sinus above. Thank you for watching.